The ending of the national emergency doesn't mean that COVID-19 is no longer going to be an issue for anyone. It does mean that if you or someone that you know is infected by COVID-19 or it impacts you in some way, it's going to transition to more of a normal health care issue and expense. It's been 3 years since the world was turned upside down and a pandemic basically started that impacted everyone. The U.S. government recognizes it's no longer a national emergency. It comes also more than 2 years after a vaccine was widely available.
But no, I think we all figured until we got the vaccine widely deployed, it was going to be a rough road.
Dr. Stack says the Kentucky COVID community spread map today is all green. But he says the national emergency ending means federal reporting ends and some resources available online are no longer required.
So at the close of business today, that'll disappear from the website because the federal government relied on data that it was receiving during the emergency. But when
Dr. Stack says going forward, he hopes that we can do a better job of getting along when it comes to issues that sometimes we do not agree on. He says that we have not done a very good job of staying together and trying to find common ground when it comes to finding solutions to get through issues like this. In Frankfort, Phil Pendleton, WKYT.